For us, the minutes matter. And so for a heart attack, for instance, every minute that's lost in terms of getting to a hospital and getting to a lab that can open up a blocked vessel is muscle lost. Damon Darcy, an Associate Medical Director, Mississippi MedCom and Air Care, our flight program here. Shaving off minutes can make a huge difference. There's a nationwide push to decrease the time it takes from the patient when they hit the hospital door to the time they get to the catheterization lab. We're taking it a bit further. We believe we can go out further than that. We can say by the time the patient hits the first provider, paramedic or firefighter, to the time he gets to the cath lab or the heart catheterization door, that's the time that makes a difference. The morning routines go through what hospitals have what services, who has a certain neurosurgeon or a certain cardiovascular surgeon on, how many ICU beds are available. First of all, MedCom staff with some amazing people. They're all clinicians by background. They're firefighters, paramedics, EMTs. They've done this for a very long time. And we do about 75 ambulances a day inbound to our medical center. We help coordinate and dispatch our own flight service, but also manage others coming into our facility. And we do about 13,000 to 15,000 patients a year.
Before, it was a guess as to how an ambulance could get to this hospital. You kind of had to take it on, just hit the highway, hope for the best. My name is Bruce Hollingsworth. I've been in MedCom now for 6 years. I'm a MedCom Specialist 1. Nowadays, with this new implement of the MDOT cameras, I can scan from any scene just about.
It was a thought from both the Department of Transportation side and our side of how do we improve healthcare delivery in the areas in which we already have technology. And so we did. We're doing the connection through a fiber link through their system, and we're now able to monitor all of their cameras statewide. And that is huge for us in getting people here faster, quicker, and by the right method.
Anytime an ambulance is inbound to UMC with a critically ill patient, they're required to give a 20-minute heads-up patient report. My name is Stephen Houck. I'm a communications specialist here at Mississippi MedCom. I help coordinate emergency transfers throughout the state. At the time that they give that patient report, we can look at the traffic cams and try to anticipate any traffic delays. If this happens, we can inform the ambulance crew that they may need to take intercity roads so that a potentially critically ill patient doesn't get an increased time delay, which could cost them disability or even their entire life.
If an ambulance is going to get tied up in a scene and can't get free, we can figure a way to set a helicopter down somewhere to meet them. And we can, in turn, make the patient's transport time that much less.
The MSTraffic Partnership with MedCom enabled to actually see in real time the accidents and different tie-ups on the interstates, etc. You know, that's beneficial in patient care. My name is Jeremy Benson. I'm the lead flight paramedic and base manager for Jackson, Mississippi's aircraft, Air Care 1. Pre the MSTraffic project, the efficiency was not near as what it is now. We were able to go out to different locations, but didn't really have the hands-on and I guess the perception of actually seeing what's actually going on in the surrounding areas.
Your ground crews, they focus on what's happening in the scene. They look around, they plan out their LZ, but sometimes they miss things.
They're able to actually look and get a first-hand view of accident sites and scenes, as well as local areas, weather or traffic considerations where we're going to.
With the MDOT cameras, you can get a more broad view of where the aircraft's coming in from, what the LZ looks like, if there's any obstacles that the ground crews might have missed. Those kind of things we can see with those cameras.
In Mississippi MedCom, we have access to many different radio frequencies, law enforcement, EMS, fire, and we'll hear an accident get dispatched out, and we typically will listen for the address or intersection or where on the interstate it is. We then go to the MSTraffic cam system, try to locate the accident.
Right when we first started, we were able to watch a hydrofluoric acid spill on I-20 live and be able to see what the guys on the ground were seeing and how that would affect not only patient movement, but potential patient care.
And we can start noticing when ambulances and fire trucks get there, how many backboards they're pulling out, and physically the cameras are good enough to count the number of patients being loaded onto backboards and loaded into ambulances. And since we are the state's only level 1 trauma center, most trauma will come to UMC.
What's fascinating is you have two state agencies that are working really in two traditionally different fields. But if you look back on it, EMS and paramedicine and field medicine really started out of a initiative by the Department of Transportation to help decrease mortality on the roads. And so here we are again in the same exact situation where we're working together again to help decrease that mortality.
Because this is a great joint effort to bring emergency management and emergency medicine in with their program. And they expanded it. I think it helped out both parties. I mean, it definitely helped us. There's no ifs, ands, and buts about that.
In terms of selling, it was quite simple. This is logical. EMS originated out of the traffic system. EMS will grow out of the traffic management system and transportation system. This works. The total connection piece of technology between the two divisions was around $100,000. The medical center put in 75, and that was running fiber and redundant cable and getting the system to monitor. And MDOT put in roughly $25,000 to ensure that we had the right connections and ability to see and use their cameras appropriately.
Yeah, with anything in medicine, faster, qualified care and a larger scope of practice is always going to be beneficial in healthcare. With this project, makes the cohesiveness between the outside facilities to here more efficient. We're able to move patients faster, smarter, and deliver the quality patient care they need in a timely manner.
For not much money, that's pretty impressive. And what we think in the way out is how do we take that small investment and push that data out, push the data out to the ambulances through live data through another project we're working on. And so between the two of us, we've done a really neat partnership. And into the future, it just gets brighter.
The benefit of the Mississippi Traffic Cam partnership with Mississippi MedCom not only helps us make better logistical decisions as far as number of units and type of units going to emergency scenes, it helps us better coordinate the response times of our trauma team, cardiovascular specialists, neurologists, things like that, so that they can be better prepared when these patients arrive so that they can get the best and most timely treatment possible.
With the advent of more helicopters, which we have 2 now, we can cover more area in the state. The ambulances, yes, there are times when you can help them direct them around traffic on the interstates. You cut down on their response time. And we basically double patient care as far as getting them to here in a short amount of time.
Basically, anytime we can move patients faster to an appropriate facility, the patients win. The state wins in that aspect.
We can do all we can in the hospital. We can be the best in the world, whether it's us or hospitals across the state. But if we can't get patients to us fast, and we can't get patients to us in a good condition, then all the surgeons in the world, and all the ER physicians in the world, and all of the other technologies that are at bigger hospitals are not being utilized if we can't get a patient here quickly. And this partnership has allowed us to do that, to reach out, understand, to push data out, and bring patients in faster to us and to other medical facilities across the state.